Interjection. A word that expresses emotion with. Preposition. A word that shows the relationship of a noun or pronoun to some other word in a sentence. Macro. Large. Micro. Small. Hyper. Over, above. Hypo. Under, below. Touchy. Fast. Gritty. Slow. Hemi. Half. Mega. Large. Megaly. Enlargement. Semi. Half, partly. Poly. Many. Chloro. Green. Leuco. White. Cyan. Blue. Peri. Surrounding, around. Trans. Across, through. Endo. Within. Inter. Between. Para. Beside, near. Pre. Before. Post. After. Retro. Backward. Sub. Under. Superior. Toward the head. Inferior. Away from the head. Dice. Bad, painful, difficult. Mal. Bad. Emesis. Vomiting. You. Good, normal. Necro. Death. Oma. Tumor. Osteo. Bone. Derm. Skin. Myo. Muscle. Neuro. Nerve. Cardio. Heart. Thorax. Chest. Gastro. Stomach. Pod or pet. Foot. Bronchi. Arm. Memo. Breast. Nephro. Kidney. Thromo. Clot. Pneum. Lung. Arthro. Joint. Cephal. Head. Hemido. Blood. Ectomy. Surgical removal. Gram. To record. Graph. Instrument for recording. Otomy. Cut into, incision. Scopy. Visual examination. Ology. Study of. Ostomy. Create an opening. Amaya. Condition of blood. Itis. Inflammation. Osis. Abnormal condition. Pathy. Disease. Plegia. Paralysis, stroke. Fascia. Speech. Oma. tumor. AAA. Abdominal aortic aneurysm. AICD. Automatic implantable cardioverter defibrillator. AMA. Against medical advice. AP. Anterior and posterior. APC. Atrial premature contraction. BM. Bowel movement. BP. Blood pressure. BPH. Benign prostatic hypertrophy. BUN. Blood urine nitrogen. CA. Carcinoma. CABG. Coronary artery bypass graft. CAD. Coronary artery disease. CBC. Complete blood count. CPD. Common bile duct. CC. Chief complaint. CHD. Coronary heart disease. CHF. Congestive heart failure. CVA. Cerebrovascular accident. CXR. Chest X-ray. DC disc. Discontinue or discharge. DX. Diagnosis. ECG, EKG. Electrocardiogram. EEG. Electroencephalogram. FB. Foreign body. FO. Fever of unknown origin. FX. Fracture. GB. Gallbladder. GI. Gastrointestinal. HCT. Hematocrit. HNP. History and physical. HTN. Hypertension. HX. History. IABP. Intra-aortic balloon pump. CUB. Kidney, ureter, bladder. LMP. Last menstrual period. LP. Lumbar puncture. MI. Myocardial infarction. MVP. Mitral valve prolapse. NV. Naso and vomiting. NGT. Nasogastric tube. OBS. Organic brain syndrome. OD. Right eye. QD. Daily. ORF. Open reduction internal fixation. OS. Left eye. PAT. Pre-admission testing. P. Pulmonary embolism. PMH. Past medical history. Port. Portable. PRN. As necessary. KID. 4 times a day. RBC. Red blood cell. RO. Rule out. RX. Prescription therapy. SOB. Shortness of breath. STAT. Immediately. T. Transesophageal echocardiogram. TIA. Transient ischemic attack. TERP. Transurethral resection of the prostate. URI. Upper respiratory infection. UTI. Urinary tract infection. VQ. Ventilation perfusion scan xenon and lung. VCG. Voiding cystoreprogram. WBC. White blood cell ratio. A comparison of two numbers by division. Road atlas. 1 gallon. 8 pints. 1 pound. 16 ounces. Number of cups in a gallon. 16 cups. Gram is measure of. Scale/mass. The liter is a measure of blank. Volume. 1 kilogram. 2.2 pounds. 1 yard. 36 inches 3 feet. 1 gram. 1000 liters/mg. 1 tons. 2000 pounds. Respiratory system functions. Transport oxygen from atmosphere into the capillaries of the lung and to transport CO2 from lungs out. Respiratory system. Brings oxygen into the body, gets rid of carbon dioxide, O2 in and CO2 out. Respiratory occurs at the end of bronchioles in the alveoli. Alveoli. Covered in a thin aqueous surfactant that allows O2 and CO2 gases to diffuse across it to the lung capillaries, which will accept the new O2. Inhalation occurs when diaphragm muscle contracts while the rib intercostal muscles open up the rib cage. Exhalation. When diaphragm relaxes, exhalation occurs. Breathing. Controlled by medulla oblongata. Disease of the lungs. Pneumonia. 1 inch. 2.54 centimeters. Digestive and respiratory systems. What two systems make use of pharynx? Help support the trachea while still allowing it to move and flex during breathing. What is the function of the rings around the trachea? Delivers body heat to nasal cavity. Why do you suppose the lungs are so vascularized? If a sharp object were to pierce the diaphragm, a person may die. Why? Couldn't breathe. 1 year. 52 weeks. What is the name of the flap that covers the trachea when swallowing? Epiglottis. Digestive system function. Breaks down food, absorbs nutrients, and removes waste. Digestive system organs. Mouth, salivary glands, esophagus, stomach, small and large intestines, liver, gallbladder, pancreas, rectum, anus. Digestive with circulatory. Absorb and deliver digested nutrients to cells. Digestive with nervous. Triggering appetite, digest. Digestive with muscular. Move the food along the digestive tract when muscles contract. Circulatory system. Transports materials to and from cells. Circulatory organs. Heart, veins, arteries, capillaries, red blood cells. Circulatory with respiratory. Deliver oxygen from lungs to cells and drop off carbon dioxide from cells to lungs. Circulatory with digestive. Absorbs and delivers nutrients to cells. Circulatory with excretory. Kidneys filter cellular waste out of blood for removal. Circulatory with lymphatic. Both transport things to and from cells. Circulatory with immune. Transports white blood cells throughout body to fight disease. Circulatory with nervous. Brain controls heartbeat. Cards. 52 deck. Nervous system. Gathers and interprets information, responds to information, helps maintain homeostasis. Nervous system organs. Brain, spinal cord, peripheral nerves, neurons, hypothalamus. Nervous with hypothalamus. Maintains homeostasis by working with all systems, controls all other systems. I. 1. V. 5. X. 10. L. 50. C. 100. D. 500. M. 1000. Excretory function. Removes waste products from cellular metabolism, filters blood. Excretory major organs. Kidneys, ureters, bladder, urethra, lungs, skin, sweat glands, liver. Excretory with circulatory. Filters waste out of blood. Excretory with lungs. Removes excretory waste. Excretory with integumentary. Removes excretory waste also. Respiratory function. Takes in oxygen and removes carbon dioxide and water. Respiratory major organs. Nasal cavities, sinuses, larynx, trachea, bronchi, lungs, alveoli. Circulatory with endocrine. Transports hormones. Symmetry. Having the same shape, size, and position on both sides of a dividing line. Bimodal. 2 peaks. Unimodal. 1 peak. Outlier. Uniform. Always the same, no correlation. Dependent clause. Does not express a complete thought and cannot stand alone as a sentence. Independent clause. A clause that can stand alone as a sentence. Alveoli. Tiny air sacs in the lungs where exchange of oxygen and carbon dioxide takes place. Asthma. A lung disease characterized by inflamed, narrowed airways and difficulty breathing. Bronchi. The main passageways directly attached to the lungs. Bronchioles. Small passages in the lungs that connect bronchi to alveoli. Cystic fibrosis. A genetic disorder that occurs in people with 2 copies of a certain recessive allele characterized by an excessive secretion of mucus and consequent vulnerability to infection, fatal if untreated. Perfusion. The passage of fluid to an organ or a tissue. Pleura. A membrane around the lungs and inside the chest cavity. Surfactant. A fluid secreted by alveoli and found in the lungs. Tidal volume. Amount of air inhaled or exhaled with each breath under resting conditions. Trachea. The windpipe which connects the larynx to the lungs. Ventilation. movement of air in and out of the body via inhalation and exhalation. Arteries, blood vessels that carry blood away from the heart. Capillary, the smallest blood vessels that connect arterioles to venules. Diastole, the portion of the cardiac cycle in which the heart refills with blood. Heart, the muscle that pumps blood throughout the body. Hemoglobin, the protein in red blood cells that carries oxygen from the lungs to the rest of the body. Leukocyte, white blood cells which protect the body against disease. Platelets, blood clotting or thrombo. Lymph, clear fluid that moves throughout the lymphatic system to fight disease. Lymphocyte, a subtype of white blood cell found in lymph. Plasma, the pale yellow component of blood that carries red blood cells, white blood cells in platelets throughout the body. Systole, the portion of the cardiac cycle in which the heart expels blood. Vein, a blood vessel that carries blood to the heart. Anus, opening of the rectum from which solid waste is expelled. Bolus, a mass of food that has been chewed and is ready to be swallowed. Chyme, a semi-liquid mass of partially digested food that moves from the stomach to the small intestine. Enzymatic digestion, the breakdown of food by enzymes for absorption. Gallbladder, stores bile. Large intestine, also known as the colon, where vitamins and water are absorbed before feces is stored prior to elimination. Liver, the organ that produces bile, regulates glycogen storage, performs other bodily functions. Mouth, the oral cavity at the entry to the alimentary canal. Pancreas, the gland of the digestive and endocrine systems that produces insulin and secretes pancreatic juices. Peristalsis, a series of muscle contractions that move food through the digestive tract. Rectum, the last section of the large intestine ending with the anus. Small intestine, the part of the intestine that runs between the stomach and the large intestine, the duodenum, jejunum, and ileum collectively. Stomach, the organ between the esophagus and small intestine in which the major portion of digestion occurs. Myelin sheath, covers the axon of some neurons and helps speed neural impulses. Axon terminal, the endpoint of a neuron where neurotransmitters are stored. Cell body, largest part of a typical neuron, contains the nucleus and much of the cytoplasm. Dendrites, receive messages from other cells. Anatomical position, hands at sides, palms forward. Cells, basic unit of life / smallest unit. Cellular functions, process that include growth, metabolism, replication, protein synthesis, and movement. Organ system, a group of organs that work together in performing vital body functions. Organelle, a specialized part of a cell that has a specific function. Organ, a self-contained part of an organism that performs a specific function. Sagittal plane, divides body into left and right. Coronal plane, divides body into front and back. Transverse plane, divides the body into superior and inferior parts. Tissue, a group of similar cells that perform the same function but as a lower level of organ. Autonomic nervous system. The part of the nervous system responsible for control of the unconscious bodily functions such as breathing, the heartbeat, and digestive processes. Axon. Nerve fiber that carries nerve impulse away from neuron cell body. Contraction. The process of becoming smaller. Muscle. Fibrous tissue that produces force and motion to move the body or produce movement in parts of the body. Nerve. A bundle of nerve fibers. Reflex. Involuntary response to a stimulus. Relaxation. Release of tension in a muscle. Synapse. A structure that allows a neuron to pass an electrical or chemical signal to another neuron. Cervix. The passage that forms the lower part of the uterus. Estrogen. Female sex hormone. Fallopian tubes. Tubes which carry eggs from the ovaries to the uterus and which provides the place where fertilization occurs. Ovary. Organ in which eggs are produced for reproduction. Penis. Organ for elimination of urine and sperm from the male body. Prostate. The gland in males that controls the release of urine and secretes a part of semen that enhances motility and fertility of sperm. Scrotum. A pouch of skin containing the testicles. Testes. The organs that produce sperm, also called testes. Urethra. Tube that carries urine from the bladder to the outside the body. Uterus. Womb. Vagina. The tube that connects the external genitals to the cervix. Vas deferens. The duct in which sperm moves from a testicle to the urethra. Constrict. To become narrower. Dermis. Middle layer of skin. Dilate. Become wider. Epidermis. Outer layer of skin. Excretion. Elimination of metabolic wastes from body. Gland. Organ that secretes a substance. Integumentary system. The organ system comprised of the skin and its associated organs. Skin. The thin layer of tissue that covers the body. Subcutaneous. Under the skin. Sweat. Perspiration excreted by sweat glands through the skin. Adrenal. A gland above the kidney that produces hormones to regulate heart rate, blood pressure, and other functions. Hormones. Chemical messenger produced by a gland and transported by bloodstream that regulates specific processes in the body. Parathyroid. An endocrine gland in the neck that produces parathyroid hormone. Pineal gland. A small gland near the center of the brain that secretes melatonin. Pituitary. The endocrine gland at the base of the brain that controls growth and development. Thymus. The lymphoid organ that produces T cells. Thyroid gland. The gland in the neck that secretes hormones that regulate growth, development, and metabolic rate. Cardiovascular system. This system comprised of the heart and blood vessels. Kidney. A pair of organs in the abdominal cavity that filter waste, unused minerals, and water that make up urine. Nephron. The part of the kidney responsible for filtering and excretion. Renal arteries. The two branches of the abdominal aorta that supply the kidneys. Renal medulla. Inner part of the kidney. Renal pelvis. The center of the kidney where urine collects before moving to the ureter. Renal vein. A vein carrying blood from a kidney to the inferior vena cava. Renin. Urea. Ureter. Urinary bladder. Urine. Celsius. /1.8. Fahrenheit. F equals 9/5C plus 32. Main idea. Never a sentence. Supporting details. Complete sentence that helps justify the main idea. Persuasive writing. Makes you feel pulled to agree. Descriptive text structure. Paints a picture in your mind. Renal cortex. Outer layer of the kidney. Epi. Above, upon.